Hello and welcome to Healthy Aging Blueprint. I'm truly grateful you're here. On this channel, we explore simple, powerful ways to care for your body, nurture your mind, and live with purpose at every stage of life. Wherever you're watching from, I wish you good health, peace, and lasting happiness. If you find value in today's video, don't forget to hit that subscribe button and turn on notifications so you never miss a step on your journey to aging well. Could the pills you trust be silently damaging your heart? What if the real danger isn't your age, but what's inside your medicine cabinet? Millions of seniors are taking these medications daily, without realizing the hidden harm they may be causing. As a heart surgeon with decades of experience, I've sat across from countless patients, many over the age of 60, who come in feeling breathless, unusually tired, or burdened by chest discomfort. They worry it's aging, maybe stress or something genetic. But more often than you'd think, the real culprit isn't what they feared. It's the very medications they've been faithfully taking for years. In this video, I'm going to reveal 7 of the most dangerous pills that older adults take regularly, often without any idea that these drugs may be quietly damaging their heart. These aren't obscure medications. They're household names, commonly prescribed or taken over the counter. And yet, their long-term effects on your heart health are far more serious than most people realize. It's absolutely essential that you stay with me until the end, because one of these medications might already be sitting in your bathroom cabinet. And knowing this information could protect your heart and potentially save your life. Before we dive in, if you find value in content like this, I'd greatly appreciate it if you gave this video a like. It helps us continue spreading these important health lessons, especially for those over 60. And if you haven't already subscribed, make sure to do that and turn on notifications so you never miss a future video. If you find this helpful, comment 1 below. If not, feel free to comment 0. Your feedback helps me make this better for you. Let's begin with the first medication on the list. Non-steroidal anti-inflammatory drugs, often known as NSAIDs. NSAIDs include a wide range of familiar over-the-counter and prescription medications like ibuprofen, Advil, Motrin, naproxen, Aleve, and even high-dose aspirin. These drugs are frequently used by older adults to manage persistent pain caused by arthritis, joint inflammation, muscle soreness, or back issues, conditions that tend to worsen as we age. Because the pain is constant, many people over 60 take NSAIDs on a daily basis, believing them to be safe and effective. But here's the concerning part. Most users don't fully realize how these drugs can significantly increase the risk of heart problems over time. Despite their short-term pain relief, NSAIDs have been shown to elevate blood pressure, cause fluid retention, and increase the risk of heart attacks and strokes, especially in older individuals with pre-existing cardiovascular issues. NSAIDs work by blocking certain enzymes in the body that contribute to inflammation. This is what makes them effective for reducing pain and swelling. But this same mechanism can come with unintended and sometimes serious side effects, particularly for the cardiovascular system. While many people take these medications to ease discomfort, they often don't realize that NSAIDs can quietly disrupt critical functions inside the body. One of the main concerns is how NSAIDs affect fluid balance. These drugs can cause the body to retain sodium and water, which leads to a buildup of fluid in the tissues. That retained fluid increases blood volume and forces the heart to work harder to pump, placing additional strain on a system that may already be weakened by age or pre-existing heart conditions. Over time, this elevated pressure can quietly pave the way to serious health issues like heart failure or atrial fibrillation, an irregular, often rapid heartbeat that increases the risk of stroke and other complications. But the risks don't stop there. Prolonged use of NSAIDs has been linked to damage in the blood vessels and reduced kidney function, 2 factors that play vital roles in cardiovascular health. The kidneys help regulate blood pressure and filter waste from the bloodstream. When their function begins to decline, blood pressure can rise even higher, compounding the burden on the heart. This becomes especially dangerous for seniors who are already managing high blood pressure or taking heart medications like ACE inhibitors or diuretics. NSAIDs can interfere with these treatments, reducing their effectiveness without any obvious signs, while the cardiovascular strain continues to build silently in the background. Perhaps the most troubling part is that these changes often don't come with immediate symptoms. There's no flashing warning light or sudden alarm. Instead, the damage accumulates slowly, quietly, until it becomes something serious and difficult to reverse. That's why older adults need to be extremely cautious when using NSAIDs, even if they're available over the counter. Their convenience and familiarity can create a dangerous false sense of safety. For those with heart concerns, safer alternatives for managing pain, such as acetaminophen, Tylenol, gentle exercise, or physical therapy, may be more appropriate. The key is to avoid self-medicating long-term without professional guidance. Always speak with your healthcare provider before using NSAIDs for more than a few days, especially if you have underlying heart or kidney issues. If you have a history of heart disease, high blood pressure, or kidney issues, even short-term use of NSAIDs should be approached with caution. Pain relief is important, of course, but it should never come at the cost of your cardiovascular health, especially when safer alternatives are available. Now let's talk about another class of medications that many seniors rely on without fully understanding the risks. Thiazolidinediones, often abbreviated as TZDs. These are a type of prescription drug used to help manage type 2 diabetes, especially in older adults. Common examples include pioglitazone, Actos, and rosiglitazone, Avandia, both of which are still used to improve insulin sensitivity and keep blood sugar levels under control. While TZDs can be effective in managing glucose, they come with a serious warning, especially for people over 60 who may already be living with heart-related conditions. These medications work by increasing the body's responsiveness to insulin, but at the same time, they often cause the body to retain excess fluid. That fluid doesn't just lead to minor puffiness, it can result in swelling in the legs, ankles, and other parts of the body, a condition known as edema. This fluid retention isn't harmless. It puts additional pressure on the heart and raises the risk of congestive heart failure, a serious condition where the heart struggles to pump blood efficiently. For seniors, especially those already at a higher risk of heart disease due to high blood sugar, elevated cholesterol, or hypertension, the impact can be dangerous, even life-threatening. When you add a medication that causes the body to hold on to even more fluid, it creates a perfect storm for cardiovascular strain. Perhaps even more concerning is that TZDs can blur or hide the early warning signs of heart failure. Symptoms like fatigue, swelling, or shortness of breath can easily be mistaken for typical aging or simply chalked up to diabetes-related fatigue. That delay in recognizing the true cause can mean missed opportunities for timely treatment and worsening heart function before anyone realizes what's happening. For seniors with a history of heart disease, even mild heart failure, or risk factors such as obesity, TZDs can quietly accelerate cardiovascular damage while appearing to do their job of lowering blood sugar. It's a trade-off that, for many, simply isn't worth the risk. Fortunately, there are other options. Medications like metformin, which is widely regarded as a first-line treatment for type 2 diabetes, are generally better tolerated and carry fewer cardiovascular risks. In recent years, newer drug classes like SGLT2 inhibitors have shown promise not only in managing blood sugar, but also in offering potential heart protective benefits. If you're currently taking a TZD, it's essential to have a candid conversation with your doctor, especially if you're noticing symptoms like swelling, unexplained weight gain, or difficulty breathing. These could be early signs that your heart is under strain, and a different diabetes medication might be a safer, more suitable option for your long-term health. Managing blood sugar is essential, especially for seniors living with diabetes. But it's just as critical to protect your heart along the way. Striking the right balance between both can be the key to long-term wellness. If you're still here watching and finding this information helpful, please take a moment to comment the number 1 below to let me know you're still with me. Your time means a lot, and I appreciate your commitment to learning more about your health. Now let's move on to the next medication on our list: sedative hypnotics, more commonly known as sleeping pills. Sleep disturbances are incredibly common among older adults. Whether it's difficulty falling asleep, staying asleep, or waking too early, many seniors turn to medications like zolpidem, Ambien, esopiclone, Lunesta, or even older benzodiazepines like diazepam, Valium, to find relief. On the surface, these drugs appear to offer a simple solution: take a pill, get some rest. And while they may provide short-term improvements in sleep quality, their long-term effects, particularly for individuals over 60, can pose serious risks to cardiovascular health. Sedative hypnotics function by slowing down the central nervous system. This includes decreasing brain activity, lowering heart rate, and reducing blood pressure to help induce sleep. At first glance, that calming effect might seem beneficial. But here's the issue. By depressing the body's natural physiological responses during sleep, these medications can interfere with vital systems that need to stay responsive, even while you rest. For example, one of the most concerning risks is the potential for these medications to trigger or worsen sleep apnea, a condition where breathing repeatedly stops and starts throughout the night. Sleep apnea isn't just disruptive. It puts enormous strain on the heart by lowering oxygen levels and forcing the body to work harder to compensate. Over time, this can increase the risk of arrhythmias, irregular heartbeats, elevated blood pressure, and even heart failure. These medications also don't work in isolation. They can interact with heart-related prescriptions like beta blockers or calcium channel blockers, reducing their effectiveness and potentially compromising the treatment of pre-existing heart conditions. For seniors already managing multiple medications, this can silently increase vulnerability. The risks extend beyond the heart, too. Older adults are far more susceptible to the side effects of sedative hypnotics, such as confusion, dizziness, and loss of coordination. These side effects can lead to falls, injuries, or hospitalizations, which in turn may trigger further cardiovascular complications. In the long term, ongoing use of these drugs may also contribute to cognitive decline, making it harder to manage daily routines, remember medications, or make informed health decisions, all of which indirectly affect heart health. Instead of relying on sedative hypnotics night after night, seniors should consider exploring safer, more sustainable alternatives. Options like cognitive behavioral therapy for insomnia, CBTI, relaxation exercises, breathing techniques, or addressing the underlying causes of poor sleep, such as pain or anxiety, can often deliver real results without the harmful side effects. If you're currently taking a sleeping pill on a regular basis, it's important to speak with your healthcare provider. Together, you can weigh the risks and explore safer, non-pharmacological strategies that protect both your heart and your brain, especially as you age. Now let's turn our attention to another class of medications that often flies under the radar but poses serious cardiovascular concerns: tricyclic antidepressants, also known as TCAs. These medications, including amitriptyline, nortriptyline, and imipramine, were once widely prescribed for depression, anxiety, and even chronic pain conditions like migraines or nerve pain. And while they can be effective in certain cases, their use, especially among seniors, has declined for a good reason. TCAs carry a well-documented risk to heart health, making them a questionable choice for individuals over 60. What makes these medications risky? TCAs interfere with the heart's electrical conduction system. This disruption can lead to serious complications, such as arrhythmias, heart block, where electrical signals in the heart become delayed or completely blocked, and sudden fluctuations in blood pressure. For older adults who may already be dealing with atrial fibrillation or bradycardia, a slow heart rate, even small doses of TCAs can make things worse, and the danger doesn't disappear with time. In fact, it can grow. Long-term use of tricyclic antidepressants, even at low doses, has been associated with cumulative cardiovascular damage. Over time, the risk of a heart-related event, like fainting, stroke, or cardiac arrest, can significantly increase. But the risks of TCAs aren't limited to the heart alone. These medications often cause side effects like dizziness, sedation, and orthostatic hypotension, a sudden drop in blood pressure when standing up. For seniors, that combination can be dangerous. Falls become more likely, and injuries sustained during a fall can have long-lasting consequences that go far beyond the initial incident. Unfortunately, despite the availability of safer options, some healthcare providers continue prescribing TCAs, often because they're familiar with them or because the medications are inexpensive. But newer antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, offer similar benefits with significantly less cardiovascular risk. These modern alternatives are generally better tolerated and more suitable for older adults. If you're currently taking a TCA and have experienced symptoms like heart palpitations, dizziness, or excessive fatigue, don't ignore them. These signs could indicate a deeper issue with how your body is responding to the medication. Make it a priority to speak with your doctor. Through regular monitoring and an open, informed discussion, you may be able to switch to a safer treatment that still addresses your mental health or chronic pain without putting your heart at risk. If you're still watching this video and finding the information helpful, please comment the number 2 below. Your feedback lets me know you're here and that these lessons are making a difference. Thank you again for staying with me through this important conversation. Your time and attention mean a lot. Now, let's talk about pill number 3, decongestants, specifically pseudoephedrine and phenylephrine. These ingredients are commonly found in over-the-counter cold, flu, and allergy medications. Brands like Sudafed and many popular cold remedies include them, and they're widely used by seniors to relieve nasal congestion, sinus pressure, or seasonal allergy symptoms. On the surface, they seem harmless. After all, they're readily available at any drugstore without a prescription. But beneath their quick relief lies a potential danger, especially for those over 60. Decongestants work by constricting blood vessels in the nasal passages, helping to reduce swelling and clear up breathing. However, this vasoconstrictive effect doesn't stay limited to your sinuses. It affects blood vessels throughout the body, including those that supply blood to your heart. As a result, decongestants can lead to elevated blood pressure, an increased heart rate, and extra strain on the heart muscle. For older adults, especially those who already deal with hypertension, arrhythmias, or any form of heart disease, this added stress can become a trigger for much more serious complications. In some cases, it may lead to heart palpitations, irregular rhythms, or even heart attacks if left unchecked. One of the most concerning issues is how easily these symptoms can be overlooked. Side effects like jitteriness, anxiety, restlessness, or dizziness might seem minor at first, but for seniors, they can be early warning signs that the heart is under pressure. And as we age, the body becomes more sensitive to these effects. Factors like reduced kidney function and stiffer blood vessels amplify the way medications are absorbed and processed, making older adults particularly vulnerable. There's also a common misconception that because something is sold over the counter, it must be safe. But in reality, even short-term use of decongestants can be risky for seniors, especially when taken without fully understanding how they interact with pre-existing heart conditions or other medications. To reduce these risks, it's crucial for seniors to read medication labels carefully, watch for hidden decongestant ingredients in combination products, and avoid taking these drugs without speaking to a healthcare provider. A quick conversation with your doctor or pharmacist can help you find safer alternatives that treat congestion without jeopardizing your cardiovascular health. Older adults, especially those with high blood pressure or heart disease, should be cautious when it comes to choosing cold or allergy medications. Avoid products that contain pseudoephedrine or phenylephrine, even if they seem harmless. Instead, safer alternatives, like saline nasal sprays, steam inhalation, or non-decongestant antihistamines, can often provide the same relief without compromising your heart health. As always, consult your healthcare provider before using any decongestant, especially if you're managing other medications or cardiovascular conditions. Now let's look at pill number 2, a group of medications you might not expect to find on this list. Proton pump inhibitors, or PPIs. These drugs are often seen as harmless, but the truth is more complicated, especially for older adults. PPIs such as omeprazole, pantoprazole, and esomeprazole are among the most commonly prescribed medications in the world. They're widely used to treat acid reflux, gastroesophageal reflux disease, GERD, and chronic heartburn, issues that tend to become more common with age. Many seniors rely on these medications daily, often believing them to be safe for long-term use. But recent research has raised some serious concerns. These drugs work by drastically reducing the amount of acid produced in the stomach, which can effectively relieve that burning sensation and prevent esophageal damage. While this may sound like the perfect fix, long-term suppression of stomach acid can have unintended consequences, particularly when it comes to your heart. One major concern is magnesium deficiency. Stomach acid plays a key role in helping the body absorb vital nutrients, including magnesium. Over time, the reduction in acid can impair this process, leading to chronic low magnesium levels, also known as hypomagnesemia. Why does this matter? Because magnesium is essential for maintaining a healthy heartbeat, muscle function, and overall energy levels. When magnesium drops too low, the result can be serious. Symptoms may include irregular heart rhythms, arrhythmias, muscle weakness, fatigue, and in more severe cases, even seizures. For seniors, who may already be managing multiple health conditions, this added strain on the heart can be dangerous. But it doesn't stop there. Long-term use of PPIs can also disrupt the gut microbiome, the delicate balance of good bacteria in the digestive tract. When this balance is thrown off, it can lead to systemic inflammation, which has been closely linked to atherosclerosis, the hardening of the arteries, and other forms of cardiovascular disease. Emerging studies have also found that prolonged PPI use may increase the risk of heart attack and stroke, particularly among older adults who already have existing risk factors like high blood pressure, diabetes, or prior cardiovascular issues. And because these medications are often taken for months or even years without reconsideration, the risk can quietly build over time. If you've been taking a proton pump inhibitor for more than a few weeks, it's crucial to pause and reassess whether it's truly necessary. These medications are often prescribed for extended periods, sometimes years, without ever addressing the root causes of acid reflux. Conditions like dietary triggers, obesity, or a hiatal hernia may go unmanaged, while the medication masks the symptoms. Often, meaningful lifestyle adjustments can reduce or even eliminate the need for long-term PPI use. Something as simple as avoiding acidic or spicy foods, eating smaller meals, and maintaining a healthy weight can dramatically improve symptoms. But too often, these changes are overlooked in favor of medication alone. If PPI use is truly unavoidable, regular monitoring becomes essential. Seniors should work closely with their healthcare provider to track magnesium levels, heart rhythm, and other cardiovascular markers. These drugs should always be taken at the lowest effective dose and for the shortest duration possible. Alternatives may also be worth exploring. For those with milder symptoms, H2 blockers like ranitidine, when available and appropriate, or over-the-counter antacids may offer relief with fewer long-term risks. But the key principle remains the same. Treat the cause, not just the symptoms. Managing acid reflux effectively means looking at the whole picture, not relying indefinitely on a pill that could silently be increasing your risk of heart disease. If you're still watching this video and finding these insights helpful, please comment the number 3 below to let me know you're still here with me. I truly appreciate your time and your commitment to your health. Now, let's take a closer look at pill number 1, calcium channel blockers, and the risks they may pose, particularly for seniors. Calcium channel blockers, or CCBs, are a widely prescribed class of medications, especially among older adults. They're commonly used to treat high blood pressure, hypertension, angina, chest pain, and arrhythmias, or irregular heart rhythms. You might recognize names like verapamil, diltiazem, nifedipine, or amlodipine. These are some of the most frequently used drugs in this category. When used properly, calcium channel blockers can be life-saving. They help reduce blood pressure, alleviate chest discomfort, and stabilize heart rhythm, functions that are essential in managing many cardiovascular conditions. However, it's important to understand that not all calcium channel blockers are created equal, and for seniors, certain types, particularly older formulations like verapamil and diltiazem, may carry risks that outweigh the benefits, especially with long-term use or when not closely monitored. Understanding how these medications work can help clarify the concern. Calcium channel blockers act by preventing calcium from entering the muscle cells of the heart and blood vessels. By doing this, they relax and widen the arteries, which improves blood flow and reduces the workload on the heart. This mechanism makes them effective for treating high blood pressure and chest pain. In the case of arrhythmias, CCBs can help bring irregular heart rhythms under control. The same mechanism that makes calcium channel blockers effective, relaxing blood vessels and slowing heart rate, can also cause unwanted side effects, particularly in older adults. As we age, natural declines in heart and kidney function, combined with the use of multiple medications, can increase our vulnerability to complications. The dangers of calcium channel blockers for seniors should not be underestimated. Age-related changes in the cardiovascular system make it harder for the body to adapt to even moderate adjustments in blood pressure or heart rhythm. When combined with the body's slower metabolism and the common use of other prescriptions, the risks begin to stack up. Let's take a closer look at some of the most common and serious issues. 1. Excessive heart rate slowing. Some calcium channel blockers, especially verapamil and diltiazem, belong to a subgroup known as non-dihydropyridine CCBs. These medications are particularly potent in their ability to slow down the heart rate. While that may be helpful in treating certain arrhythmias, in seniors with naturally reduced cardiac output or pre-existing heart conditions, it can lead to bradycardia, a condition where the heart rate becomes abnormally slow. What does that look like in daily life? Symptoms of bradycardia can include dizziness, lightheadedness, fainting, and severe fatigue. These may seem like general signs of aging, but they could be warnings that your heart isn't pumping fast enough to meet your body's needs. This not only diminishes your quality of life, but also greatly increases the risk of falls, a major safety concern for older adults. In more advanced cases, the heart's electrical signals may become so impaired that it leads to heart block, a condition that may require a pacemaker to correct. 2. Fluid retention and swelling. Another concern involves a different class of calcium channel blockers, known as dihydropyridines, such as nifedipine and amlodipine. These medications are more likely to cause peripheral edema, or swelling in the legs and ankles. This occurs because these drugs can alter the way blood vessels and fluid regulation systems function, allowing fluid to accumulate in the lower extremities. For seniors, this kind of swelling isn't just uncomfortable. It can make walking more difficult, worsen mobility, and even lead to skin breakdown or infections if left unaddressed. In some cases, fluid retention can also trigger or worsen shortness of breath, especially in those with underlying heart or kidney issues. The added weight and pressure from fluid buildup may seem subtle at first, but can significantly affect day-to-day life. 3. Drug interactions. Let's not forget that most older adults take multiple medications to manage various conditions. Adding a calcium channel blocker to that mix can create unexpected and sometimes dangerous drug interactions. Many seniors take multiple medications to manage chronic conditions, and this increases the likelihood of drug interactions, especially when calcium channel blockers are part of the mix. These interactions can quietly amplify risks in ways that often go unnoticed until symptoms become serious. Take verapamil and diltiazem, for example. These older calcium channel blockers can interfere with the metabolism of statins, which are commonly prescribed to lower cholesterol. When this happens, statin levels can rise in the bloodstream, increasing the risk of muscle pain, and in more severe cases, a dangerous condition known as rhabdomyolysis, a form of muscle breakdown that can damage the kidneys. Calcium channel blockers can also interact with beta blockers, another class of heart medications. When combined, the risk of bradycardia, abnormally slow heart rate, or hypotension, low blood pressure, can become more pronounced. For seniors whose systems are already more sensitive, this can push the body into a dangerous zone without immediate warning signs. Another issue that often gets overlooked? Masking symptoms as aging. One of the challenges with calcium channel blockers is that many of their side effects, like fatigue, dizziness, or swelling, can be easily mistaken for typical signs of getting older. This misattribution can delay important conversations with a healthcare provider and allow medication-related problems to go undiagnosed for weeks or even months. Seniors may continue taking the medication without realizing that what they're experiencing isn't simply aging. It could be a drug effect that's quietly growing more harmful over time. So, what can seniors do if they're taking calcium channel blockers? It starts with staying proactive and informed. Regular communication with your healthcare provider is essential. Here are a few important steps to consider. 1. Routine monitoring. Make sure your doctor is routinely checking your heart rate, blood pressure, and overall cardiovascular status while you're on a calcium channel blocker. Blood tests should also be done periodically to assess kidney function and monitor electrolyte levels, particularly potassium and magnesium, which play a crucial role in heart rhythm. 2. Report symptoms promptly. If you notice signs like dizziness, fainting, swelling in your legs or ankles, shortness of breath, or a noticeably slow pulse, don't ignore them. These could be early indicators of medication-related complications. The sooner they're addressed, the better the outcome. 3. Explore safer alternatives. Not all calcium channel blockers carry the same risk. Newer options like amlodipine may be better tolerated by some seniors than older drugs like verapamil or diltiazem. Additionally, depending on your condition, your doctor may recommend switching to other classes of blood pressure medications, such as ACE inhibitors or ARBs, which may offer similar benefits with fewer cardiovascular side effects. 4. Never stop abruptly. If a change in medication is needed, it's critical to do so under medical supervision. Stopping calcium channel blockers suddenly can trigger rebound effects, including a rapid spike in blood pressure or sudden chest pain. Any adjustments should be made gradually and with guidance to ensure safety. Any changes to your medication regimen should always be made under your doctor's supervision. This isn't just a precaution, it's a vital safeguard. The true power of calcium channel blockers lies in their ability to control and manage serious cardiovascular conditions. But with that power comes responsibility, both from those who prescribe them and from those who take them. That's why oversight is so important. These medications aren't inherently dangerous, but they must be used with careful attention to detail. Seniors and their healthcare providers need to maintain open communication, conduct regular assessments, and make sure that these drugs are not only effective, but also safe over time. Even well-intentioned treatments can quietly become harmful if not reviewed periodically. So, what did you take away from today's video? Was there a particular medication you didn't realize could affect your heart? Or maybe you're already thinking about speaking with your doctor about one of the pills you take every day. I encourage you to take a moment and share one insight you've gained in the comments below. Your voice matters, and your story could help someone else make a life-saving decision. If this video has helped you feel more informed and empowered, please don't forget to like, share, and subscribe to our YouTube channel for more expert guidance designed specifically for seniors. Let's continue to learn together, protect our health, and age with strength and confidence. Wishing you continued health, happiness, and peace. And remember to subscribe to Healthy Aging Blueprint for more inspiring and practical content tailored just for you.